Hello, everyone. My name is Dr. Idyoro Ojukwu. I'm an obstetrician gynecologist and a gynecological oncologist. I'm a South Sudanese currently practicing at the Mater Misericordia Hospital in Nairobi. I am very passionate about women reproductive tract cancers, specifically cervical cancer, and more specific, I'm more interested in cervical cancer prevention and screening. So my leadership project is actually to look into the practices of women attending mother and child health clinic at Juba Teaching Hospital towards cervical cancer screening and prevention program. So the purpose of this project is, number one, women are dying of cervical cancer in South Sudan. There is no screening program in place. There are limited treatment facilities, a limited access to specialized treatment by our women. And this is partly attributed to lack of knowledge about cervical cancer screening and prevention. So I would like to comprehensively assess and understand the knowledge of these women towards cervical cancer prevention and screening. At the same time, I'll be looking for some solutions and intervention to achieve the accessibility to cervical cancer screening and prevention program. Number one is government policies should actually prioritize women reproductive tract cancers and more specifically cervical cancer. And through this project, I might be able to attract donor funding towards cervical cancer screening and prevention programs in South Sudan. And hence, we might even be able to start national HPV vaccination program for young girls 9 to 15 years, which is currently unavailable in the country. So the main challenge is there is no activity concerning cervical cancer screening in South Sudan. So the outcomes from this leadership project will actually inform the development of targeted interventions to improve awareness, enhance participation, and mitigate barriers in the context of cervical cancer prevention. So the end result will be improvement in knowledge on cervical cancer. And once the knowledge is improved, definitely there will be increased accessibility to cervical cancer screening and preventive program. And at the same time, it will also help in improved uptake of HPV vaccination once implemented. And this will also help in availability of treatment of both pre-malignant and malignant lesions of the cervix. And hence, we are going to have reduction in mortality due to cervical cancer in South Sudan. The WomenLift health leadership journey has actually brought the best out of the silent woman that I was, and it has helped me connect to other women leaders. And now I'm able to take the front seat and discuss matters women's health. And through the individual coaching and mentoring touch points, I'm able to build confidence. And that's why I'm able to access offices at the MOA to discuss matters about cervical cancer screening in South Sudan. And what does it mean for women to come forward? I would say every woman can be exceptional in their own way, and every woman is an achiever. So let's all come together to lift a woman who will lift another woman. Thank you for your time.